Mayzent is the first and only pill with evidence in progressive multiple sclerosis, and it has the potential advantage over Gilenya in that you may not need a first dose observation. We're going to talk about the mechanism of action, the unique dosing regimen, and of course the results in clinical trials and side effects. I have some timestamps if you want to skip ahead. And remember what Stephen King said, the truth is in the details. Mayzent or siponimod is a simple small molecule pictured here, and it's similar to the multiple sclerosis drugs Gilenya and Zeposia. Gilenya is the first drug in this class FDA approved in 2010. This drug can easily cross the blood-brain barrier, but its primary action is in the peripheral immune system. It is a sphingosine 1-phosphate receptor modulator, or S1P phosphate receptor modulator, and it prevents lymphocytes, a subclass of white blood cells involved in inflammation in MS, from exiting the lymph nodes and getting in to the brain, spinal cord, and optic nerve. Now, there are 5 S1P receptors, 1, 2, 3, 4, and 5, and Mayzent primarily has affinity for S1P receptors 1 and 5, so it's a little more selective than Gilenya, although the efficacy and side effect profile is very similar. The dose of Mayzent is 1 tablet orally daily, and there's a 1 milligram or 2 milligram dose dependent not on your weight, but your genetics. It turns out there's some genetic variability in your ability to metabolize this drug, as I'll explain in a moment. And as I said, the potential advantage over Gilenya is you may not need to do the first dose observation. So you can see here a model of the lymph node and inflammation of MS. You can imagine you have lymphocytes, B and T cells in the lymph nodes. They egress or exit from the lymph nodes, cross the blood-brain barrier, and cause inflammation in the nervous system. These drugs block the exit of these lymphocytes, and blood counts of lymphocytes drop by around 70 or 80%, and sometimes when we do blood tests of people taking these drugs, we can see it looks like they have AIDS. Their CD4 positive T cells are very, very low. However, the risk of infections is much lower than we would expect based on the lymphocyte counts. These next few slides show the titration to start this drug. So you start at a low dose and go up slowly. And this first slide is for people with favorable genetics. In other words, they metabolize Mayzent well, and they're able to take the 2 milligram Mayzent dose. And so you can see you start with these 0.25 milligram tabs. Day 1, you just take 1 tablet. Day 2, you also take 1 tablet. Day 3, you go up to 0.5 or 2 tablets, then 3 tablets, then 5 tablets. Then you go up to the full dose of 2 milligrams, and you take a separate single 2 milligram tablets. However, if you miss even a single day, it's recommended to just go ahead and start over at day 1. And if everything is favorable, if you have a normal EKG, you don't have risk factors for a slow heart rate with the first dose bradycardia, you don't necessarily need to be monitored as you do with Gilenya. Now, it turns out there's this gene, CYP2C9, in the cytochrome system of the liver, and it influences metabolism of Mayzent. And there are 3 genotypes, 1, 2, and 3, and you have 1 copy of the gene from your mother and 1 copy from your father. And this genotype 3 is associated with slow metabolism. And so if you have 1 copy of this gene, in other words, you have genotype 1/3 or 2/3, it's recommended to take a lower dose of Mayzent, only 1 milligram. And this is the titration schedule you would use. You would start at 0.25 milligrams, take 1 tablet on day 2, then go up to 0.5, then 0.75, then the full dose of 1 milligram. And again, if you miss a dose, you would just start over at day 1. So it's not that the drug is worse if you have these genotypes, it's just that you take a lower dose for it to have similar efficacy. Now, for people who have 2 copies of genotype 3, they metabolize the drug so poorly, it's recommended just to not take it because it could be toxic. Next, we move to the results of clinical trials. What I'm showing you is the EXPAND study, which is in secondary progressive multiple sclerosis, Mayzent versus placebo. And this is actually the only phase 3 study done on this drug. So the drug is approved for both secondary progressive MS and relapsing forms of MS, but the typical phase 3 trials for relapsing MS were not done. But this drug is so similar to Gilenya, and there are phase 2 studies suggesting it's roughly equally effective and safe compared to Gilenya, and so the FDA decided to approve it for relapsing MS, but this is really the only phase 3 study done. And so what we're looking at here is 3-month confirmed disability progression. And what this means is the percentage of people in the study who got worse had an increase in their disability based on the EDSS, or Expanded Disability Status Scale. And it wasn't just fluctuation. They were followed up 3 months later and they were still worse. So it was confirmed disability progression. And you can see many people did get worse, but fewer people had progression taking Mayzent in blue compared to placebo in red. It was only a 21% difference, a modest but statistically significant difference. Now, one thing I'll say is this study population was relatively young, and a lot of people did have some relapses and active lesions. So no one knows for sure whether or not this drug would work in, say, a 65-year-old with long-standing progressive MS who has not had recent relapses and new active lesions. In fact, subgroup analysis of this study suggests that it's definitely more effective in younger people with a lot of inflammatory activity. Now, this drug is very good against inflammatory activity. This is the MRI data looking at increase in T2 lesion volume on MRI, and you can see those taking Mayzent in blue did get a slight increase in lesion volume, but not much change, much less than placebo. This was highly statistically significant. Again, this is the same study, the EXPAND study in secondary progressive MS. They also looked at change in brain volume. It turns out everyone is losing brain volume even with normal aging, but people with MS tend to lose brain volume a little bit faster. But Mayzent did slightly slow brain volume loss. This isn't a huge difference. You can see Mayzent in blue and placebo in red, but it was statistically significant with a p-value of 0.02. Now we move to the side effects, and a quick reminder, talk to your own provider for medical advice and up-to-date information. Of course, one concern with any immunosuppressant is the risk of infections, although surprisingly, the risk of serious infections isn't that high. In one randomized trial, the risk was 2.9% in people taking Mayzent compared to 2.5% with placebo, so not really a huge difference. Another side effect is macular edema, or swelling of the back of the eye, which occurs in about 1 in 200 people. You can get something called first dose bradycardia, or slowing of the heart rate when you first take the drug. Of course, the titration schedule is designed to prevent that, but in someone who has certain heart conditions or who takes certain drugs such as beta blockers or calcium channel blockers, or who has abnormalities on their EKG, it's probably not a good idea to take this drug, and it can actually cause serious heart conduction problems such as atrioventricular block or atrial fibrillation. I've seen one person get atrial fibrillation with Gilenya, for example. It can also cause respiratory effects or shortness of breath or changes on pulmonary function tests, which usually isn't a big deal. Sometimes it can cause liver injury or elevation of liver enzymes. It's not recommended in pregnancy or breastfeeding because it can cause birth defects. It can actually cause a slight elevation of blood pressure, usually not a big deal. And it can actually cause something called post-Gilenya or post-Mayzent rebound. And this is well known with this class of medications. The idea is that you stop the drug, for instance, due to pregnancy, loss of health insurance, or you don't want to take it because you're feeling well, for instance, and then you actually get worse. And some people get a very, very severe relapse. So it's not recommended to stop this medication for no reason. And if you have to stop it, for instance, planned pregnancy, you generally want to change to a different disease-modifying therapy first to prevent this effect. The idea is that you stop the medication, and those lymphocytes that were trapped in the lymph nodes in your armpits, and your necks, and tonsils, they get out, and then they immediately get into the brain and spinal cord. And this can occur several months later. So let's look into more details. Some of the infections which have been reported include shingles, a painful rash, herpes infections such as cold sores or genital herpes, COVID-19, and I'll show some data on that. PML, or progressive multifocal leukoencephalopathy, is the brain infection caused by the JC virus, most associated with the multiple sclerosis drug Tysabri, but it has also been seen with Mayzent and other infections such as cryptococcal infections, cryptococcal meningitis, which is a fungal infection. So this is an MRI of someone with PML, and it's very rare with Gilenya. The risk is reported to be approximately 15,000 to 1, according to one review article. Generally speaking, being JC virus antibody positive is not a contraindication to taking this drug. You just have to accept this very small risk. This drug, Mayzent, and similar drugs such as Gilenya are associated with COVID-19 and greater probability of severe COVID-19. This is an older study on the similar drug Gilenya from the National Health Service, And you can see the period prior to vaccination and after vaccination. You can see this dotted line is the percentage of people vaccinated. And you can see prior to vaccination, there wasn't a huge difference in the rate of people getting COVID, but after vaccination, there was an approximately 40% increased risk with Gilenya, presumably because Gilenya decreases the efficacy of all vaccinations. It doesn't necessarily make vaccines completely ineffective, it just reduces their efficacy. There is a little bit of data specifically on Mayzent, and you can see this is as of December 27, 2020. So this is prior to vaccination, this is prior to Omicron, so certainly this isn't what we're looking at now, but you can see that a small number of people have asymptomatic infections, many people have mild infections, but a decent number of people have moderate, severe, or even critical infections, and some people the outcome was not reported. I suspect that the data would be a lot more favorable if we looked at the modern era after vaccination, after Omicron, where mutations in the virus seem to have made it somewhat less virulent, and my experience is recently people getting infected taking these drugs tend to do a little bit better than before, but certainly this class of drugs does increase the risk of COVID-19. This is an ocular computed tomography, or OCT, of someone with macular edema, swelling of the back of the eye. You can see the lucency in the macula representing the edema. The risk is low, only about 0.5% or 1 in 200. I've never seen this in my whole career with Gilenya, but it's a known side effect. It's more common in people with diabetes. The good news is if you stop the drug, it generally resolves, it generally goes away, and often people are recommended to see an ophthalmologist for an evaluation and OCT prior to starting the drug, and then 4 months afterwards, and of course repeated if there's a change in vision. It can also have slight respiratory effects. I've really never seen this before, but on pulmonary function tests, PFTs, there can be a slight loss of lung function. Only 88 milliliters on average of the forced expiratory volume in the first second, which is a very, very small amount. You're breathing in and out huge volumes, but it is a statistically significant and real effect, and some people could report shortness of breath. So for people with existing lung conditions like poorly controlled COPD, you may not want to take this drug. Liver injury has also been reported. I haven't seen this a lot, but elevated liver enzymes occur in 10.1% taking Mayzent versus only 3.7% receiving placebo. They usually happen early on, within 6 months of starting the drug, and generally speaking, they return to normal within 1 month of stopping Mayzent, so severe permanent liver injury would be uncommon. Hypertension has been reported in 12.5% getting Mayzent versus 9.2% getting placebo, although the average increase is very small, 3 millimeters of mercury systolic, 1.2 diastolic. So if you have a blood pressure of 120 over 80, on average it would increase to around 123 over 81, not really a big deal for most people. Now, the underrated side effect is rebound. People stop the drug and sometimes get much, much worse, and sometimes they could have a more severe relapse than they've ever experienced naturally with MS. This is a single case report of someone who developed tumefactive, or tumor-like inflammation in the brain after stopping Gilenya. This wasn't with Mayzent, it was with a similar drug, Gilenya, but this patient unfortunately died. Now, this is very rare, but I just want to give you warning because it is a real side effect. The other concern with Mayzent is drug-drug interactions. Now, I mentioned this cytochrome system CYP2C9 in the dosing of the drug and the genetic testing. There's actually one other cytochrome system involved, CYP3A4. And drugs which inhibit these cytochrome systems can increase the levels of Mayzent. One example would be the antifungal agent fluconazole. However, drugs which induce these cytochrome systems can increase the metabolism of Mayzent and decrease levels in the blood. For example, the TB or tuberculosis drug rifampin. The good thing is there's no known interaction with estrogen or progesterone products, so generally birth control pills are thought to be safe and effective with this drug, which is very important because young women taking Mayzent don't want to get pregnant on it because of the known birth defects. And just for reference, I'll show you some of the CYP2C9 inhibitors and the CYP3A4 inhibitors. Note, for instance, certain common blood pressure medications, diltiazem and verapamil, along with grapefruit. And the CYP2C9 inducer, rifampicin, is the same thing as rifampin I mentioned earlier. And CYP3A4 inducers, including common seizure medications, phenobarbital and phenytoin or dilantin, St. John's wort used to treat depression, and glucocorticoids or steroids. However, generally speaking, a brief course of steroids used to treat a multiple sclerosis relapse is considered to be acceptable. So because of all these potential problems, there are tests recommended prior to starting Mayzent. Now, generally speaking, once people are on the drug, it's sort of smooth sailing with very few, if any, day-to-day side effects. But because of these potential risks, this is the testing that's usually recommended. An EKG, just to make sure there isn't an existing heart problem, a complete blood count, liver function test, and testing for the CYP2C9 genotype to determine the proper dose, 1 milligram or 2 milligram, an ophthalmologic evaluation, and OCT. And for people with certain conditions, you may need to do the first dose observation where you're actually monitored to make sure the heart rate doesn't go too low. For most people, that's not necessary. You have to test for immunity against shingles, varicella zoster virus, immunoglobulin G, and you may need a vaccination against shingles if you're not immune. And because this drug is known to reduce the efficacy of vaccinations in general, it's a good idea to get any necessary vaccines prior to starting the drug. Spirometry or lung function test could be performed, but I think it's only really needed for people with certain known lung conditions, just my personal opinion. Now, who is it that needs first dose monitoring? According to the product label, people with a resting heart rate under 55, those with heart problems such as heart block, significant EKG abnormalities, or prior heart attack or heart failure. My personal opinion, people with these last three, maybe just consider an alternate disease-modifying therapy. And for the first one, if someone has a resting heart rate that's low just because they're an athlete or they're very physically active, maybe it's not really riskier than the general population. Now, if the heart rate is low because of taking beta blockers or some other condition, that's a different story. But my personal opinion, if the heart rate is low just due to exercise, I don't really think that would increase the risk or necessitate first dose monitoring. Now, as I mentioned before, this drug is not recommended in pregnancy or breastfeeding as it may cause birth defects. Studies in pregnant rats and rabbits are very unfavorable and suggest it is toxic to the embryo or fetus. Mayzent is eliminated from the body in approximately 10 days, although given the variability in metabolism, you may want to give it a little bit more time prior to attempting pregnancy. Now, as I said, because of post-Gilenya and post-Mayzent rebound, it's not really recommended to just stop the drug and try to get pregnant. One strategy that's been used is changing to a different medication, such as a B-cell depleter, Ocrevus, Kesimpta, or rituximab, that doesn't have this rebound effect. Just one possible strategy. Also, Mayzent is a small molecule that can get into the breast milk, and so it's not recommended while breastfeeding. Some other miscellaneous topics: because Mayzent is an immunosuppressant, you're not supposed to take vaccines with living components, such as the old shingles vaccine. Killed vaccines, such as the flu vaccine or COVID-19 vaccines, are perfectly fine. However, if Mayzent is interrupted by 4 or more days, your heart can essentially forget that it has seen Mayzent, and you can actually get this first dose bradycardia, or slowing of the heart rate. And so you're actually supposed to redo the titration that I mentioned before. So once you're taking it for a while, if you miss 1 dose or 2 doses, that's acceptable, but 4 or more consecutive days, and you're supposed to redo the titration. As I mentioned before, people with the genotype CYP2C9 who have both copies of genotype number 3 metabolize Mayzent very poorly, and it could be toxic. So it's better to just choose a different disease-modifying therapy. This is only 0.5% of the population, more common in Caucasians. There's also one other rare side effect with Mayzent I didn't mention, which is posterior reversible encephalopathy syndrome, or PRES. This is swelling of the brain that can be caused by other things like other drugs or hypertension. This is very rare but has been reported with Gilenya and could be a potential side effect of Mayzent. If you have any questions or comments or requests for future videos, please post in the comments below. My name is Brandon Beaver. I make videos about MS every Wednesday.